Hi, for those of you who wonder why you couldn't hear me, it's because we are starting promptly at 8 o'clock and we were muted until then. Welcome. It's 8 p.m. Eastern. I'm COL Preczewski. I'm the president of Riverside Military Academy. I have the privilege of chatting with you tonight. Many of you sent in questions ahead of time, and I'll begin with those in just a few minutes. Let me give you a quick overview because people are signing in as we're chatting, so we'll just give it a couple minutes of talking about the weather, which right now, heavy thunderstorms are rolling through the area. So it's pouring rain outside. Everything's green. It's taking all the pollen off of the cars. So it's getting to be pretty nice to be around here right now. We had a very nice ceremony today. One of our students who's been here for 6.5 years, one of the very few, he's a senior. He's graduating. He's going to go directly onto active duty. He was leaving and signing out today, so he had completed all his coursework, passed all his exams. So we had a very, very mini commencement exercise for him and gave him his diploma and cheered him on his way as he departed campus. So good things are happening, and we're continuing to have, I guess, about 16, 15 students left on campus. They're taking their final exams now, and the last students will depart the campus on Wednesday. So it's really quite pleasant around the campus when it's quiet and it's beautiful and the lake's full. So we're getting there. So we've got 51 people on board. It's 2 minutes after, so we're going to go ahead and get started. The big questions that people have, and most of them are asking me specific questions, and I do mean, so my cousin's getting married on October 12th. Will I be able to leave? The answer is, I don't know. And a lot of these you're going to hear, I don't know, because I don't think any of you know either. This virus has really turned the world upside down. And I don't mean America, I mean the world. And so any plans that people had back in February for what they were planning on doing in April and May, to my knowledge, I don't know anybody whose plans haven't changed or haven't been affected in some way. From air travel to cruises to wedding cancellations to deaths in the family and so on related to COVID. There are people out there who have their beliefs that no one has died from this disease, that this disease does not exist at all, and that the entire world has got it wrong. For those of you, I'm sorry, I'm not going to be able to help you tonight or allay your fears because we are going to continue to follow whatever the government regulations are and whatever the preponderance of the healthcare officials tell us to do. And so whether you believe them or don't believe them, then write to your politician. But we are going to follow, and as we've been following all the state, federal, county, city government recommendations, and we're following the best practices that we know about and we learn about each week. If you think about what we knew in mid-March about this disorder, this pandemic, and what we know now, what we know about treatments, they had miracle cures back then. It turned out to be that they're not working. We had vaccines are around the corner. Vaccines aren't around the corner. Today, there's an announcement that there's a new vaccine. It's going to be coming right out very quickly. And then all of a sudden by noon, it was like, well, let's slow that down a little bit. So if someone has all the answers of when this is going to end, when the miracle cure is going to come, or when the miracle vaccine is going to come and has evidence of that, I'd love to have it. But right now, it's a lot like buying a lottery ticket. And so you go with the best knowledge that you have, stay current in every way. And I hope that you'll trust that we're doing the things in accordance with the best interests of your individual student and the best interests of the institution. To that end as well, as you may or may not know from previous broadcasts, but weekly I am on multiple national webinars from the accrediting agencies to the legal people who handle this kind of a pandemic, governmental officials, associations that are for private schools throughout the country. As an example, about 3 weeks ago, they ran a webinar nationally about how to close permanently your school and put it out of business, sell the buildings and so on, how to do that properly. 1,800 people logged into that seminar on how to permanently close your school. I was very proud to say we didn't log into that one. We're here. We're going to stay. We're continuing to thrive, and as your students are hopefully thriving as well. So with all of that, again, I'll give you the best information I have right now, and anything I tell you right tonight can change by the time this broadcast is over, depending upon any announcements that come out of the White House, out of the governor's office. The governor has issued, I believe, now 4 or 5 executive orders directing what we can and can't do with schools. And to be clear, as of today, still, all sports activities, as per the state, are suspended, and they have no estimate at all about when they're going to be meeting to see if they can lift that suspension. And so I'll address sports as we move on in a few minutes. Here are the first questions, and I'll group them into an answer. Was the 6-day week schedule approved? No, it was not approved. It was never approved. It was a survey that went out to all parents asking you for your input about whether you would support or want something like that or not. And it ran about 50-50. Some of you said, yes, get as much education in as you can. And some of you said, no, I can't send my child there if it's going to be 6 days a week. It's just too much for him. So have we approved that? No. Are we going to approve it? I don't know. I don't know what it's going to be like in July 25th when we're opening up. To be very, very clear right from the start, it is my intention to be as normal and routine an opening and a normal as routine a year as we can possibly have. If the virus is under control, the pandemic's under control, or the treatment thereof is out there and available, or vaccines become available, we will have a normal, people go home on weekends, you come visit, and it's just like it's always been at Riverside. The reason we're starting earlier are twofold. The reason we're starting in July is because the majority of you indicated 2 things. One, you would like to start right now and get your student back onto campus. And that's not unusual. You've had your children home for quite a while, and you like to get them back out into the environment here at Riverside. Well, I can't start right now, even if I wanted to, because of the rules that are in place in the state of Georgia for gatherings and social distancing. We're believing that those should be eased. Every indication from the governor's office is that we're going to continue to reopen the state in a systematic and safe fashion as testing continues to increase. Please be very, very careful that testing is a very different statement. You can get a test. That doesn't mean you can get a result. So many of the labs are backlogged right now and taking considerably as long as 2 to 3 weeks for them to be able to get test results back. So testing does not equal results. Testing means you take the test, you can take your final exams, but it may be a couple days before you get the results from those exams. Well, it's the same thing with this COVID testing. And many of the rapid tests have a high false negative rate. And that's a problem. If somebody is infected and is saying that they're not, and then they're in and among the group and spreading the infection, that's problematic. So we're waiting to see what are the best tests, when will they be available in quantity. And we also need to know who's going to be paying for those tests. Are those going to be paid for by the state, or are those going to be paid for at the federal level? But people were asking for us to get started as soon as possible. So that was one part of why we wanted to start earlier. Second reason we wanted to start earlier was we're under the assumption that your primary concern is to get your student through an educational program and complete with a diploma and hopefully off to a college or off to a meaningful job. In order to do that, we are an accredited high school, which means when colleges look at your student's application and where that school is from, all colleges, and I know because I was a college president and I also ran an admissions office, all colleges look at, is the school from which the student's coming an accredited school or not. So we are an accredited institution by SACS and by SAIS, and we have to meet certain accreditation standards. Those standards require so many days of contact with the student and so many minutes per class subject area when we have that day of contact. That contact can be physical in a classroom, or it can be digitally, as you've been experiencing at home right now. So we have to meet accreditation requirements. If, as we're hearing so much from at the federal level and at the state level as well, not so much at the state, but as at the federal, and from healthcare officials, there's a strong belief that this pandemic will reemerge again sometime in the late fall, early winter, at the same time that the regular flu occurs. If that's the case, then we will have to, again, go into digital learning. We do not want to do that if we can avoid it. So one of the ways that we're trying to do is say, if we start early and get a lot of our teaching in person in place, that can allow us to let the students go home during that period without instruction, but will be current on our academic program. And then after the worst of the winter passes, or the worst of the pandemic passes, we can get the students back in the early spring. Again, those are all ifs. If everything is normal and everything settles down, we will have a normal year with the normal breaks, with the normal visitation. So that was the reason for the 6-day schedule, is to try to keep us moving along in accordance with accreditation and get as many days as possible in. It was not, none of those days at all are going to be makeup days for any missed curriculum for this current year. We have met all the accreditation and learning outcomes and objectives for the courses that were taught for this semester. That's very much unlike those schools who went ahead and closed early in March or April and then declared the year is over. Whatever your last grade is now your grade. I feel, frankly, quite sorry for those students when they go off to college, because as a college president, I'm going to tell you that when a student comes in and it says they graduated from a school, we're assuming that they learned all the content they were supposed to learn. We would not be making any exceptions for the fact that, oh, that was a COVID year, so we have to teach what they missed in high school. That's why we also continued our program, to maintain our accreditation standards and to ensure that your student is prepared for college level coursework. Will that cause us, since we're starting early, will it close us to finish earlier in May? It may or may not. Again, if in fact we have to take a long break in the middle because the pandemic is flared back up, then no, we may even have to go late into May or into early June in order to meet the accreditation requirements of the number of days of contact. Our intent is to try and stick as close to the schedule as possible. If we wind up with some extra days, it could result in a longer winter break, or it could result in a longer spring break, or it could result in us finishing a few days early in May. Even there, many people ask, well, what would happen if we finished way early? Well, then we could look at, since you've already paid the tuition and the academic work is done, we can go into some extensive leadership training, military and physical training, basically in some adventure training to make it more interesting for the cadets while they're still here, because those funds will have been allocated to us already by you, or you can pull your student home. Along those same lines, we are integrating the leadership camp that you would normally pay for and the Raider camp that you would normally have paid for separately. They're going to be integrated during the month of July and August, either during GSA or on Saturdays when we have the cadets here. If everything was exactly the same as it is right now, if all the conditions were exactly the same as they are reported right now for the state under the executive order that we're under from the governor right now, I would probably propose and probably decide, again, probably, because things can change within the next hour while we're having this meeting with you, I would probably decide that for the first 4 or 5 weeks that we would have closed weekends for those first 4 or 5 weeks to see how many kids might have brought the virus to campus. Are we stable? Are our deliveries, are our procedures and protocols, are those working to keep us safe and secure and healthy here on campus? If the conditions begin to ease, then we would ease those restrictions. But if it was today, under the restrictions we have right now, I would say that we would have closed weekends for the first several weekends. Again, that can change tomorrow if the executive orders change, or if the executive orders wear out, or if something else happens out in the outside environment. Keep in mind, too, that the current executive order from the governor, which was signed at 3:02 p.m. Last week, expires on May 31st. We anticipate that there'll be some new executive orders that will come out, again, depending upon what the conditions are. If school starts July 25th, will the 6-day schedule go into immediate effect? No. Does this mean it's a closed campus until Christmas break? Absolutely not. And I wouldn't close a campus ahead of time for that long of a duration of time, because so much is changing on a daily and weekly basis. It would be foolish of me and irresponsible of me to make decisions that would bind the entire year on certain issues of which we have flexibility. What are the plans for Thanksgiving? Well, again, it's the same question. What are the plans for the virus? What are the plans for the healthcare industry? What are the plans for the governor's office and the president about what orders they're going to provide? I could say to you that we plan to let your students come home for Thanksgiving week as normal. But what if we have a major outbreak here and the governor quarantines us and says we can't leave, as the governor of New York did to New Rochelle? These are things I can't possibly answer because I can't possibly forecast the future. What I could tell you is that, again, we're trying to plan things normally. We know it's in your interest to have the student home on Thanksgiving. But if it's a decision between having your student home for Thanksgiving and jeopardizing the health of that student or the health of the campuses upon return, that's going to might be a different decision. But right now, things are expected to be relatively normal. I printed a copy of a letter from the chancellor or the president of the University System of South Carolina. And as an example, they've already made a decision that they are canceling fall break and canceling the normal holiday breaks that they take for like Labor Day or Veterans Day. And they've already announced in their letter that they're going to have face-to-face instruction beginning normally. And they're going to stay by canceling all those other breaks. They too, because they're under accreditation restrictions, they too are going to be holding classes frequently and not on vacation days. They're not canceling those classes. They may go to digital learning for those days. They're going to let the students go home on Thanksgiving, and then they're telling them to stay home from Thanksgiving until they tell them to come back for the spring break. And while they're home at Thanksgiving, after the Thanksgiving break is over, they'll go digital, take their exams online, and finish the semester that way. So some people are planning out to that level of detail. But again, I don't know if he'll change once they actually get into the actual execution. If you go to 6 days, would Saturday be a half day or a full day? Again, we haven't gotten to that level because we haven't decided yet whether we're going to 6 days. One of the things that I have been talking with the dean about, and I think it's pretty creative, one of the things she's talking about is even if it's 5 days, again, which is what's currently scheduled is 5 days, that one of those days may be digital learning for the students, whichever day it happens to be during the week, for a couple of reasons. One, it allows us to space the students out. But the second thing is it keeps the students' skill set on digital learning and the expectations of it. It keeps it current. It also keeps the faculty very current in the technology. We can make sure the technology works. We can make sure that the faculty are using better and better techniques when teaching in a digital environment. The dean has indicated that Zoom, which is the platform we've been using, and you're familiar with if your student's home with you, that platform is having some improvements to the platform, better controls for the teachers, and more things that can make it more interactive with the students. And so she's going to be working with the faculty over the summer and before they leave at the tail end of the spring semester so that the instruction will be even better in the fall should we have to go to it. But by practicing it 1 day a week, it provides that opportunity to keep that skill set up. Are you requiring a closed campus for all boarding students, or will there be an opportunity to see our children as long as we follow the same criteria that is established for day students? The answer is, again, I don't know that we're going to have a closed campus for the fall. I think we'll probably start that way, but we may not start that way depending upon what the situations are. And you're all sitting there probably frustrated by now about, well, why won't he make a decision? Because things change. And we're staying current with it. And I understand this is a big investment for you. It's a big investment for us as well. We have to decide whether to issue contracts to vendors, to faculty, to staff, and so on. And we're trying to delay as long as we can to make those kinds of decisions. So safety and security. Upon return to campus, what will the screening protocol be for all students? Right now, what we're doing with students is we're checking their temperatures twice a day. And we're asking and monitoring for, are they having chills, fevers, feeling different in any way? We can get them screened very quickly by our infirmary. We anticipate that that will be the same, and we'll probably be adding testing if testing is available and affordable. We may have a requirement that the student arrive with a test, or we may have, as some schools are planning to do. And again, I am in contact during the week with the presidents of other schools, and we kick around ideas. One president was indicating that upon arrival, the student will be given 2 tests. And after they take the 2 tests, both must be negative. If one of them is positive, the student will be put into quarantine or sent home. Of course, I asked the question, are those tests available to you right now? And his answer was, well, no. Well, do you know what they cost? No. Do you know how they're going to be paid? No. But that's our plan. And so I don't know anybody who's got the information about the availability of supplies, the reliability of the tests. If they're FDA approved tests, they have a much higher standard of very few false negatives. But some of the tests out there now have false negatives as many as 15%, meaning that 100 people who take the test, 15 are told they don't have the disease when in fact they do. So we'll be looking for what are the tests that are available and are they reliable? And we'll probably part of the in-processing is for students to take those tests. And if they are positive, to be isolated or quarantined for a period of time. Let me talk about our infirmary real quickly. We have the capability of about 18 beds in the infirmary. We also are setting aside at least one wing for overflow in the event that we have a systematic outbreak of the pandemic on campus. Keep in mind a couple of things that normally we have some students quarantined during a regular normal year, even when there is no COVID virus. The flu influenza, if a student gets it in the regular school year, we isolate that student. And then we'll usually find that the roommate gets it as well. So we isolate the roommate and the student down in the infirmary. The nurse stays there overnight, supervising until the student's well enough to return back to the barracks and is no longer contagious. But what happens if you have the flu, the normal seasonal flu? You also might have a stomach flu going around, and then you might have COVID-19 going around. Well, you don't want to put those three all isolated together in the infirmary. So that's why we're setting aside some wings and seeing what other equipment we're going to need for those wings so that we can separate those. We will continue to operate until such time as we cannot, because if it becomes that widespread. That is not a forecast at all of what I think is going to happen. But I don't want to be thinking about it after it's happened. We're planning for those types of events now because, again, we're planning for the health, safety, and security of your students, which I think is what you're expecting of us. The temperature screening is a very poor indicator, but it is one that's out there and it's relatively simple to do. And we've ordered the touchless type thermometers that are FDA approved, but there'll be other screening. And again, if tests are available, we anticipate that we'll be using testing. How often will they be screened? It all depends on what the situation. If we are clean and we're not having any problems on the campus and the environment around us is a clean environment, probably upon entry and not again until we find that we have some kind of an outbreak or something is happening in the outside world that can affect us. How we screen teachers and staff, it's the way that we're doing it right now. They are responsible to tell us if they're feeling ill before they come to campus, so we can reach out and question them about whether to even bring them to campus, and we're doing temperature screening. Will you have a full-time doctor on campus this school year? No, we will not. But we do have a full-time doctor who has his own practice, who has been with us for almost 20 years now, I believe, who does come to campus 3 times a week, and he is on call for us at any time that the nursing staff, which is available 24/7, that doctor is a full-time licensed doctor with his own practice. Again, he's on campus 3 times a week now. And if we need him, we can call him at any time. And if it becomes a serious situation, we don't even call him. We immediately transport to the hospital with notification of the family. What COVID continuing education will the nurses be required to take? I'm just going to read this directly from what our nurses have been doing, are doing, and planning to do. They are participating in COVID-19 compliance webinars on the 20th of May. This course is offered through Stericycle, which is the company that teaches them on bloodborne pathogens, OSHA, HIPAA, and other compliance mandated courses for our nurses. Our head nurse is a member of the National Association of School Nurses and networked with the private, independent, and parochial school community. They have participated in interim guidance in the programming called Role of the School Nurse and Returning to School Planning. So our healthcare staff, also in concert with, like today, the county health officials also ran some instruction on if you're planning to reopen, here are the steps. We are also in communications with the local public schools on how they're planning to reopen. We're only as safe as the people around us are, and so we're staying current with them. There are also webinars that are being announced at the national level for nurses alone. There are ones for presidents. I'm participating in those. There are ones for chief financial officers. There are one for student affairs officers. And so we are participating in all of those webinars at the national level as well as at the local level. We will be participating in the Center for Disease Control COVID-19 prevention in long-term care facilities, because we are a long-term care facility. Normally that's associated with elderly, but we have our students here 24/7 for a long period of time. Hence, we have long-term care facility requirements, screenings, and so on. And so it's just a younger audience that we're using. And we are tracking all the CDC guidelines for college and university training as well. Have we considered employing a full-time APRN? We don't need to because our licensed LPNs are in fact supervised by the doctor, who again is here 3 times a week, and they can call immediately if an IV needs to be started or anything else, or if we need to be transported or medicines have to be prescribed. They can all chat with our doctor, who can give the directions, or the doctor can zip over here. He's only a few minutes away from the from the campus. Full-time doctors, COVID. Have you considered what precautions are you taking in place to mitigate the risk of exposure for boys while they are on campus? Right now, if you were here, you would see that they were sitting 2 to a table in a dining facility. So they are, what's that, a 10-foot table. They're separated 1 on each end of the table, and the tables were separated as well. They were 1 to a room. I don't know if we're going to be able to do 1 to a room. I don't anticipate that. It would defeat some of the things we're trying to do militarily. But if we are directed to do so, we will then have to figure, are we going to open up those other wings, which would reduce the number of beds we have available for isolation and so on. We don't know how many students are going to be returning. Right at 80% of you indicated you were planning to return, and the contracts now are being released for you to sign along with the refund policy, which we'll discuss in a few minutes. So we'll follow the guidance again. The governor's order has specific guidance about swimming pools, has specific guidance about dining facilities like we have and what has to happen, has guidance about the availability of disinfectant points throughout the campus, that they can't touch the utensils themselves, that they have to be rolled in a napkin and be handed. And we're making sure that our food service providers following all of those executive orders as well. I don't anticipate that we're going to require students to wear masks all day in class and all evening and in study periods and in their rooms with their roommate at this time. Again, if it's required, we'll do what we have to do. And if we cannot get availability to the proper type of mask, because as you notice, a lot of people wear their mask, their nose is exposed, or they've just simply taken a stocking, cut 2 little holes in it, and it's really not doing much to protect them. But again, we'll follow whatever regulations, rules are provided to us from external sources. Right now, if you come to our campus, well, you probably wouldn't be able to get onto campus because you don't have a reason to be here. The students who are isolated here were not allowed to have visitors. But even as I come to work every day, I have to come through a single point. My temperature is taken, and I log in that I'm okay, and then I go to class or go to my office and then walk around and see what's going on campus. But right now, all our deliveries, when our mail comes right now, it actually sits for 24 hours before it's handled. Same thing with other packages and deliveries. We look at the drivers when they come in, and if they're going to come into the building, they're screened as well. And our food service provider is, as required, not only by their organization, but by state rules, following all the rules of dealing with dining facilities. What is your action and communication plan if there's a positive case? Well, if nothing else, I hope that you've noticed we had 1 positive case since March 15th. And as soon as we had that case, we notified the people who were on the campus. We also put it in one of our letters. We stopped saying we didn't have any cases. As soon as we know, you'll know. That individual, which was not a student, it was an employee, had no contact. We were able to do trace real quick, had no contact. They were operating in an isolated way. That individual had no contact, went home, recovered, was cleared by medical personnel, and is back at work. And as an extra precaution, we kept that individual also away from the cadets. If there was no reason for an employee to be near a cadet, we kept them away from the cadets. So we had 1 case. So it looks like, even though this area is particularly high level of rates of infection, we had 1 isolated case, dealt with it, communicated it to families, and individual recovered and came back. So you'll know. If I know, you'll know. We don't hide things here at Riverside. Will classes be a mixture of online and in person once we return? That's what I was talking about, is that we may have, and it's not yet known because we're still working on the curriculum, but we likely will have 1 day a week that's online or rotated digital learning, where they're in their room or in the dining facility or somewhere else on the campus, while others are in the classrooms, to try to, again, spread it out. We're looking at the schedule to see if we can arrange the schedule so that not all the students go into the hallway at the same time in very close quarters. We're looking to see if we can't break it so that your class breaks, half come out at one time, and then go to the next class that will be vacated, and then another group switches. Again, trying to minimize the amount of people that are in confined spaces in close contact to one another. Will there be a rock cadre this fall? Yes, but it won't be the normal, we have a week ahead of time for the rock cadre to do their work. They'll likely be doing this, again, either during the GSA period or on Saturdays/Sundays for those first few weeks. Will they be reporting earlier? No. Everybody will report on the 25th or 26th of July with a start date, which is a Saturday and Sunday, with a start date of instruction on that Tuesday, the 28th. Leadership can't be on the weekends or during GSA. It'll probably be a combination of the two because we need to get our leadership in place. The cadets who had rank when they left, that will be our initial cadre of leaders as we go through the selection process late in July and into the weeks of August. Will cadets have cars on campus? Yes, but they won't be able to use them initially until we open up our weekends and let them go home. But again, I'm anticipating that the worst at the moment would be through Labor Day, but certainly for the first couple of weeks, we're going to keep them locked down on the campus, again, to make sure that the infection's not here, it's not being spread, and they're not going on and off and bringing it back to us. Is there an option for a work program to assist students who for students to work on campus to put their dollars towards their tuition? That already occurs. Actually, some of the cadets do work as food servers, but I'm not going to be putting the cadets out running lawnmowers and trimming trees and things like that, and not only because of the risk, and the heat and so on, but we have contractors who do that for us. Will there be more Goombah Grill items? The Goombah Grill is the menu, as well as the campus store is looking at producing a grab and go instead of having to go to Walmart or leave campus to get a case of Gatorade and a bag of chips. We're looking, and this came from the cadets. The cadets, in a survey back in March, provided the top 25 items they would like to have that they can quickly get in the campus store at prices competitive to if they had left the campus and gone to one of the local retailers to buy it. At first, we were getting geared up to do it by cases, and then the cadets came and said, "Hey, sir, what if we can do it like where we can get 10 of these things and 5 of those and 4 of those in a care package called A, and then another care package called B, and another one called C, where they then it's like a $20 package or a $25 package." We were actually looking at delivery to their room. If not, that they can swing by the campus store, pre-order it. It's packaged with their name on it, and they could take that back to the room. Goombah Grill, we did some improvements in the Goombah Grill in terms of televisions and some improved seating and longer hours so that they can have some variety. Can cadets bring additional items from home, like a guitar and a fan, if in the President's Club? We haven't even begun to look yet at the President's Club. We're just trying to figure out exactly when we're opening, what the curriculum is going to look like, how we're going to deliver it, and how we're going to be able to maintain all the healthcare standards. So it's not high on my list. It'll be a question that we'll answer in a future time. But right now, status quo for the President's Club. Will you continue marching? Some of the military schools have been marching. They said it's relatively difficult because they're at double arm interval, maintaining 6 feet apart and trying to keep a straight line, 6 feet in front of you, 6 feet to the sides of you, and 6 feet behind you. But at the moment, we would not be able to do close quarter marching. We would have to maintain social distancing by the rules of the state. So whether we are going to march or whether we're going to walk or whether we're going to, I don't know. If it was current conditions today, we would have to do it at double arm interval, which would be a huge formation. We'd probably have to use both quadrangles to do that. Will swimming be tentatively offered as a winter sport? Unknown. Recall that because of contract requirements that I have to do for transportation, for coaches, for supplies, for referees, and the like, we can't wait till the last minute to turn on or turn off full sports. If I turn them on and sign the contracts, then whether that season happens or not, I'm going to have to pay out those contracts without any revenue streams to cover those contracts, which is why the fall season, the state has not made its call, and they don't know when they're going to make their call. So we moved forward. So that's one issue we don't have to deal with. What I have committed to is having winter and spring sports, again, if allowed. At a minimum, we're going to be having intramurals, again, if allowed. If social distancing does not allow us to get closer together, then we're going to have to halt our physical program and probably put in a lot more leadership, military, and academic components. I don't know until I know what the conditions are as we get closer. Will swimming and Raiders be offered as intramural sports? Again, we're planning on offering a full array of sports, probably including flag football or something like that, with a campus that is isolated initially and clean of the COVID virus. But again, I won't know until we get closer in. That's those questions. What do we have here? Answered. Switching to the next list as you're writing questions in. How will appointments like doctor, dental, orthodontics, and other specialty appointments be handled? Will parents be able to check out their cadet for the day for appointments? Again, what we would strongly, and I think we're going to provide a lot of guidance in writing before the student reports. Some schools have already sent letters to their parents telling them that when their student reports back in July or August, they're going to need to bring their own supply of face masks, their own supply of disinfectant, hand wipes, gels, that they're going to have as many of their medical physicals and appointments and dental screenings, health screenings, all taken care of before they arrive. We're not at that stage yet in having those requirements because, again, we don't know what's going to be happening at the time in which we're coming back. If it was normal, I was talking today with our transportation division. We would plan that if you have a local necessary appointment, we would do our normal procedures of driving a student to their normal routine appointment, or we're looking at seeing if the medical personnel can come here. Obviously, that won't work for orthodontics. And so if there's a local orthodontist who's doing the twist and an adjustment, they'd have to continue to do that. If you're thinking about putting your student into braces, you may want to wait a year for a number of reasons. One is because of, when you're doing orthodontics or dental work, you're right there in and among the mouth and saliva and where things spread. Not so much necessarily that they're going to give it to somebody else, but that they may catch it in such a procedure. But if they have other appointments, we're going to have to ensure that the student is transported properly, is screened when they came back. So when we had to run a student recently to the airport, we separated them. They had masks on, and we decontaminated the vehicle when it comes back for the next run. Again, it's going to depend on the numbers of students and what the requirements are locally. Some parents, frankly, take advantage of this ability. They have a 1-hour appointment, 35 minutes from here, and they sign their cadet out at 7 in the morning and then return them 6 o'clock or 7 o'clock at night. Those kinds of behaviors, frankly, put the rest of the Corps at risk. And so we'll have to see if somebody does have to leave and go with a parent and go some distance for an appointment. There may be requirements, we don't know yet, but there may be requirements that when that student returns, they'll have to be in an isolated area, or a test will have to be administered to see if they are testing positive upon return or for the next couple of days after. Can't answer the question other than we recognize that there's going to be a need for medical appointments. There's going to be a need for dental and emergency appointments, and we'll act appropriately within the guidelines while trying also to protect the rest of the Corps. I just ask that you act in good faith, and if you can if you know that your student always has a health and wellness annual exam in October, why can't we see if we can't get that done in July before they arrive here, rather than risking that student having to leave campus, see a lot of people in an unhealthy environment, and bring that unhealthy environment back to campus. So a lot of questions that we have to still deal with. When will enrollment contracts be emailed or in MyRMA? I know the contracts were released today, along with the revised refund policy were released to enrollment management late today. They were testing it and posting it on a test basis. So I would imagine that they will be out tomorrow, the next day at the latest, but I believe they will be out tomorrow. Don't hold me to that, but they certainly will be out within the next 48 hours. The test program was working properly. It's a little different. The contracts are the same, whether you're a day student, an international student, or a domestic, a residential student. The contracts read the same, but when you'll have a pull down where you'll click to indicate which one you are, what day or international boarding or domestic boarding, and then that will start to populate the tuition rates, fees, and stuff like that for the rest of the contract. Associated with that, and I suggest you strongly that you read very carefully what the contract says, because the contracts are going to be even more important this year than in past years. It does refer to a refund policy. That refund policy at the moment has a maximum of a little over $15,000 refunds, dependent upon your financial aid situation and depending upon when and if we both A, are forced to leave the campus, and B, if we go to digital learning. Both conditions must occur. Along those same lines, it will take a lot for us to have to close the campus. But this time, if we do close the campus, nobody will be allowed to remain behind. And so we're cautioning people that if we have to close, in order for us to provide those refunds, we had to revamp all of our contracts with our employees and with our vendors that allow us to close down. If I have one cadet on campus, I have to have security, I have to have all the healthcare, I have to have all the food service, I have to have the laundry, all those things have to be kept open, even if there's just one student on campus. That drives up the price for everybody else. And so we've working different kinds of contracts that allow us to pass savings on to you all. That's the reason the savings weren't large this year, is because we were late into the semester. Those contracts were in place and they could not be curtailed, and people could not be laid off because their contracts were through the rest of the year. So that's why we handled it the way we did. Will there be academic or junior ROTC awards for this past year? They are. Today I was talking with the dean and the commandant. They're working on how and when we're going to announce the awards for this year, whether it's going to be a broadcast or whether it's going to be in August or July when we get back. That hasn't been determined yet. They're working that issue when I chatted with them today. How will these changes affect ENN? ENN will operate as normal and will broadcast its regular episodes online. ENN also will still compete in the STN convention, granted the threat level of the virus allows us to participate safely and the threat is low to travel. New studies show it's really unnecessary to wipe down groceries from Publix. Given that, will students be allowed to order groceries from Publix? How many new studies did we have already this year on the virus that were then proven to be incorrect studies? So the answer is, as we get guidance from the health department and guidance from the state, those are the rules that we'll be following. If RMA will authorize students coming and going to visit family and friends, how we make sure they're not coming in with COVID, we've covered that question before. Again, initially, if it's the way it is today, we will stay tight. And we'll stay tight until we can loosen and ease the restrictions. Much like states are opening back up, we would open back up. I am going to follow the rules that are available to us and the best practices. Can a student specifically request a roommate, such as a friend? That all depends whether they're a ROC, whether they're the same age group, whether there are discipline issues and so on. So just get with your admissions counselor, and your admissions counselor can work that answer for you. How many RNs and how many LPNs on staff do you have? Is there always RNs working with the LPNs? The doctor works with the LPNs. We have only the LPNs and individuals who administer and track our pharmacies issuing of pharmaceuticals to the students. So I believe there's four or five LPNs. And again, they're under the direct supervision of a doctor who's on the campus 3 times a week. We do not currently have any RNs. Will there be any reconsiderations for Amazon care packages from parents only? My guess is we're going to maintain that same standard on the care packages, because we were getting care packages that had contraband in them. We don't know necessarily that it's from you. If it's their friend who they said, hey, put my mom and dad's address on there, and contraband was coming in. So we started restricting that. Furthermore, we had lots of claims from parents because they said they sent something valuable through Amazon, and Amazon would drop it off at the gym at night and leave it outside the door, and then it wouldn't be there in the morning. So we're probably going to keep the same standards that we've done in the past in order to keep the contraband off of the campus, limited numbers of deliveries of food service by vendors that we can trust, if in fact those vendors are going to be allowed to come onto the campus, or whether they'll come to a central point. Those are details that still have to be worked out. Will the cadets get letters for sports? If they got letters in the past, they'll get letters now. When will we have parent-teacher conferences that were originally planned for Parent Day, pre-quarantine, prior to the July 25th start date? I don't know that we're going to have a Parent Day if, in fact, we can't allow visitors to the campus. So I can't answer that question until we know, because if I said it's July 25th and we're not allowed to have gatherings of more than 10 people, then I would not be able to have it. We could announce it and then we can't have it. So again, continue to, as soon as we know and as soon as we can make decisions that we believe have better than a 50-60% chance of actually coming to fruition, we'll share that information with you openly and freely. We've been doing that through these broadcasts. We've been doing that through the weekly newsletters and through letters from me to you. And then you provide me feedback. Parents have called me on my cell. Parents have texted me. Parents have also emailed me asking specific questions to their specific case. And I respond to those as quickly as I possibly can. Please note that there are about 400 of you and there's one of me. And so I can't always get to those when I'm getting 200, 250 messages a day. I get to them as quickly as I can. If it's an emergency, call me on my cell. If I'm in a meeting and it's an emergency, text to my number, which is 678-628-4872. I provided that in multiple letters to the families, 678-628-4872. Text me and say emergency, and I'll step out of a meeting. But if you call me and I don't respond right away, or I may not respond for 8 hours, because sometimes I'm in meetings nonstop through meals for 8 hours, and I don't have time to take a phone call. But if it says emergency, I'll take it, or I'll hand it to somebody else to go out in the hallway and take that message. What about the original enrollment contracts? That's a wonderful question. For those of you who signed the original enrollment contracts, you'll be getting a separate notice from the admissions division, enrollment management. We will honor the original enrollment contracts, but the original enrollment contracts provide for no refund under any circumstances, whether a voluntary withdrawal, whether your students expelled, or whether we close for a pandemic. And so if you want to stay under the old contract, we'll honor it, but it will be honored under that refund policy. If you want the new refund policy, then you would have to sign the new contract. There's been a great deal of conversation around the senior cadets. What about the 8th graders? We're going to have a small little ceremony, I believe, before our 1 or 2 8th graders leave now. And Dean Moore is today again is looking at what we can do probably upon the return. Keep in mind, every one of your individual cadets is important to you and to your family, as it should rightly be. But I've got to balance, as does the dean, as does the commandant, the entire institution. And so I can work on an award ceremony. I can work on a particular sport. I could work on a parking policy, or I can work on those things that most protect the most students in the safest, most efficient and effective and cost efficient for you way possible. Can't get it all done at once. This virus has turned so many things upside down, and guidance is unclear and changing. And every time there's a change to guidance, we may put in, several hours a piece times 10 people working on a project, only to find out that the rules have changed on us. And then all of that work goes for naught. And we have to restart. So we do things in the priority that are in the best interest of the majority of the students at the institution. As you know, I can't possibly ever, and nobody can, make every one of you individually happy. For any date that I pick, somebody's not available, and I switch to the other date, and then the persons who were available for the first one. It's tough. I got it. I'll take all the heat from you, but you got to trust that it's in my interest to satisfy as many of you as I possibly can in the most effective and efficient way I can at the lowest cost, while providing for the health, safety, and security of your individual, while guaranteeing that you're going to have a high quality educational program that leads to a diploma. That's a lot of moving parts. For those who were in the phone or in the video presentation, I guess it was 2 weeks ago, we are tracking 126 variables right now that have an impact on what we will do this fall. 126 different variables, any of which, if it comes out of tolerance, can cause us to not open, can cause us to open digitally, can cause us to open with a closed environment, meaning closed weekends. Any of those variables, if they get out of tolerance, can shut us down. And so we have to monitor those. We have to stay current on those, and then we have to adjust our plans. We have so many contingency plans to go in so many different directions. Those contingency plans can't be broad, like, oh yeah, well, we're just generally going to do this. We have to think them through at every level, because we have vendors, we have contracts, we have staff, we have faculty availability, we have health concerns. And so all of those things have to be tracked and monitored on a daily basis. So let me see what else we have here. Okay, I'm out of questions. And as you noticed, many of those questions are responded from me to you with a question, which is, what will it be like on that day when we do open, and what will it be like on the second day? And if you're asking me exactly what's going to happen at Christmas and Thanksgiving, that might as well be 10 years away right now. We're planning, again, for things to be normal, but we don't know if it's going to change. 8th grade parents want to know about a ceremony and promote. That's the same thing we just talked about. I'm not sure what the question means. What to expect for a career course? I don't know what that question means. Do you have any idea? I don't know what that question means. The 4-year aviation program, we are beginning that. We have ordered the materials, the wind tunnel and stuff, and we have a certified instructor. And we also have consulted with another school in South Carolina that had to transition in the middle of the year while they were teaching this new aeronautical engineering. That's what it's called, an aeronautical engineering program. It's a 4-year program here where they would use their electives. And they explained that what they did when they had to go digital and what they're recommending we do, which is put a lot more of the hands-on stuff up front and a lot more of the paperwork stuff on the tail end. So if you go digital, it will be about the things that you don't have to do hands-on. But we are moving forward with the aeronautical engineering program. We expect that to be in high demand. Once this first course is completed, we'll have a certified instructor for level 2, and then level 3 and level 4. We're also looking, this is, I find, particularly exciting, but we slowed down the process quite a bit. Keep in mind that we canceled all external agencies who wanted to rent our campus for the summer, which normally brings in over 3,000 different students from all around the world to the campus. We canceled all of that. And of course, we lost all the revenue for doing so. But in the means of trying to keep to get the campus completely cleaned and sanitized, so that when your students come back, they're coming into as clean an environment as we can possibly make it. That said, next summer, we're also not going to be we're not planning on hosting any external events. We're planning on running our own pretty expansive starting in late May, programs in late May, June, and July, where they can do college dual enrollment classes, makeup classes, make ahead classes, the aeronautical engineering program for those who didn't have the ability. If they're a sophomore, they won't have time to finish the program, so we'll try to offer multiple programs in the summer. Adventure training, leadership training, more athletic camps. We're trying to make the summer here just for our cadets as a separate program. Will the rifle team and airsoft team be continued this year? I don't know. We have to see whether or not there's going to be competitions where our ROTC, also junior ROTC and actually senior ROTC, that are colleges and universities, all their activities for the summer were canceled. We're awaiting guidance on what's going to be happening with the fall. We offer dual enrollment classes, absolutely, and we're intending to increase the number of dual enrollment and drop the number of advanced placement courses. Dual enrollment, if you get a C or better, you now have college credit that's transferable because it is under the accreditation of the Southern Association of Colleges and Schools, which means it's transferable anywhere throughout America. So rather than a student working all year on an AP and taking one exam and having to score basically a 4 or a 5 for it to count at colleges, and some colleges don't even take a 4, they only take a 5. And then they spent the whole year, worked all that time, took one test, had a bad day, and they get no college credit for it. If they do dual enrollment and they get a C or better, they now have a college they'll have a college transcript no matter what. But if it's C or better, that will generally count at any school, accredited school across the U.S. Boy, my voice is dying. Any other questions out there?
There's one more.
One more coming in. Hang on. When will you have the course list available? The dean is working on that and a schedule now. Keep in mind that what we're doing, we're going to be a lot more efficient as we move forward. The reason we're trying to be more efficient, we don't want to have courses that only have 2 people in it or 3 people in it. We're trying to get the class sizes to a reasonable size, but never exceeding 18. The reason for that is that helps reduce the costs to you, which allows us to increase the size of the refunds. So how else can I help you? This is going to be, this has been recorded. It will be available online for you to, if you talk to another parent or a spouse or another guardian who wants to see what's coming up. If your cadet wants to see what's coming up, this will be posted online for you. Again, I'm making myself completely available at 678-628-4872, or you could send an email to president@riversidemilitary.com, which goes to several of us in the president's office. Or if you want to write directly to me, you can send it to SCP, as in Sam, Charlie, Papa, SCP@riversidemilitary.com, and it will go into the queue with your questions. And as we're getting these questions, and there is somebody actually at home right now taking notes, typing these up, we're creating a frequently asked questions page to consolidate these questions and consolidate the answers, so that we have a record of what's being said and it's consistent for all. With that, we're going to end our event for tonight. And if there's enough questions that come in during the week, we'll go ahead and run these through the summer. They'll be announced well ahead of time. Until then, please stay safe. Your students have done remarkably well. I was incredibly pleased to see that right at 80% of you have indicated you wish to return. That's a big number. If that actually occurs and turns into contracts, it'll be the highest that anybody can remember of returning students, which speaks favorably, I think, of your belief in us and our willingness to do what it takes to protect your students, give them a great environment, give them some leadership training, get them ready to be good citizens and productive leaders. With that, I wish you and your family well and blessings upon you, and we'll talk again soon. Be well.